My name is John Hansen-Flaschen. I'm a pulmonary and critical care physician. Come visit the medical intensive care unit where I work at the hospital of the University of Pennsylvania. This regional referral ICU is staffed to treat the most complex critical illnesses. All of our patients are endangered. Many couldn't have survived to become so sick just a few years ago. Family members may visit at any time, and many stay through the nights. Sometimes they post displays of family photos and mementos on utility bulletin boards at the foot of the hospital beds. I call the best of these displays family shrines of hope. They tell stories. Here's an example. 1 year before she was married, this young woman donated a portion of her liver to her mother. The transplant was successful. The wedding was a doubly triumphant family celebration. Months afterwards, the mother's transplanted liver began to fail. She was admitted to our ICU. Lung and liver failure ensued. Days after she built this family shrine, the daughter authorized withdrawal of her mother's life support. She stood by as her mother died. A piece of her died also that day. This 30-year-old competitive triathlete and mother of an 8-week-old baby boy developed a cough and shortness of breath several days after she seemed to recover from an episode of mastitis. She was rushed to the nearest hospital in respiratory distress and was promptly intubated for mechanical ventilation. This photograph of her family shrine was taken 2 weeks later after she was transferred to our ICU. At that time, she was deeply sedated and pharmacologically paralyzed. Despite our intense effort, she died 3 days later, leaving her husband behind to raise their son. In the ICU, family members long taken for granted become the subjects of focused attention. In quiet times at the bedside, lingering family discord often gives way to shared memories of happier times. ICU family shrines mark that transition, but they are not memorials. I see them instead as visual prayers of hope and redemption. Are the prayers ever answered? This 43-year-old man liked to joke about his heartless disposition. Indeed, his transplanted heart had been removed completely after it failed. He was sustained on the cardiology service by tubes that ran from a mechanical pump implanted in his chest to an external pump driver the size of a home freezer. As he waited for a second heart transplant, the man entertained the staff with lavishly decorated holiday parties. In turn, the nurses entertained him. The man's children played often with friends at his feet in the shadow of the heart driver. After 10 months, the second transplant came. He's alive and well and living at home today. If you visit an ICU, look for family shrines of hope and imagine the stories behind them.